so much for tuning in to yet another episode of Health, and More Health. Today we are joined by Dr. Mukama, and he will take us through so much. A little reminder, Dr. Mukama is a nutritionist consultant with us at Dynapharm. Your host is Tracy, as usual. Dr. Mukama, you're very welcome once again.
Tracy, very nice seeing you again.
Wonderful.
You look so beautiful. Was it the cleanser or other?
Thank you, chlorophyll.
Excellent.
So thank you guys for tuning in. Do not forget to like and subscribe to our channel, and you'll get unlimited content to enjoying your health. Remember, health is wealth. So in today's discussion, we want to disintegrate diabetes. We've had so many people talk about zenina sukali, nalwala sukali, simanyi sukali jenamujja, oba nali nywa nnyo sukali, ono waddala gwe tuteeka mu chai. So leero tugenda byogerako byonna. We are welcoming you to this very heated discussion. Dr. Mukama is going to break down diabetes for us, tell us what causes diabetes, what is diabetes in the first place. Is it actually sugar, quote unquote, as we've normally heard it, that causes diabetes? So let's hear from Dr. Mukama.
Wow.
Tell us about what is diabetes. I want to know. I've grown up, my mom is always telling us, Tracy, don't take a lot of sugar, you will get sukari. Not diabetes, you will get sukari. So that's what I've grown up. I know a little bit of information about diabetes, but I know I've never got an expert advice about it. So let's hear it. What is diabetes?
Thank you very much, Tracy, for hosting me once again. And I love today's topic because it concerns our health. Diabetes, sukari. Now, I want to explain to a layman to understand diabetes or sukari. Now, the moment in our surroundings they use the word sukari, it means they are referring to diabetes. So, we need to understand diabetes. Now, to understand diabetes very well, actually the standard word is diabetes mellitus. It is diabetes mellitus. To mean, for you are cutting off the mellitus, the right word is diabetes mellitus, or the sukari we are talking about. Now, what is diabetes? And people ask, do we need sugar or we don't need sugar? Now, once we talk about diabetes, you can't understand diabetes unless you understand carbohydrate digestion.
Okay.
Now, when we eat foods, there are those foods that give us the energy. We refer to them as carbohydrate foods. And we can have examples. Maybe for you can now give me examples of carbohydrate foods that you know.
I think posho has carbohydrates.
Posho, yes, right.
Carbohydrates only. Corn, because
Corn,
it's posho.
Sweet potatoes, rice.
Matoke does.
Cassava.
Is matoke
yes,
carbs?
Matoke is also partly there. The yams. Those are carbohydrate foods. Now, when we eat carbohydrate foods, they undergo digestion. Digestion simply is the breakdown of foodstuffs to give you what you require in the body. And carbohydrates, once they are digested, or the foods we've talked about, the final product of their digestion is glucose.
Okay.
And glucose, we literally call it blood sugar.
Oh, that's why we think it's sukari.
Exactly. Though that word sukari is used in a wrong context. Because we shall find out later that actually everyone needs sugar. But what quantities of sugar? Now, once these foods are broken down and they give you glucose, that glucose is absorbed into your blood stream to be transported to different parts of the body. because even your toe needs sugar. Your brain needs sugar. Now, once that glucose is in blood, then it must move from blood into the cells to give you the energy. I want us to go slow so that we understand this mechanism. The moment you have glucose in your blood, and that's why when you go check for sugar, they pick your blood sample and they check for glucose levels. So this glucose or sugar, a certain amount of it must move from the blood into the cells. Tracy?
Yes.
A certain amount of glucose must move from blood into the cells to give you the energy, and even for storage if it is excess. That's why later on we shall find out that actually when you take in excess sugar, it can lead to overweight or obesity. Now, a layman will ask, what moves the glucose from your blood into the cells? It is a hormone called insulin produced by the pancreas. I want to go back a little bit. You eat your posho, your rice, your sweet potatoes, they undergo digestion, they produce glucose as the final product. That glucose moves from your stomach into the blood for transportation, but a certain proportion must move from the blood into the cells to give you the energy. If it's a lot, part of it is stored.
Stored?
Yes.
Okay.
Now, it means in our blood there must be a certain amount of glucose that should remain. Now, if that glucose that is left in blood is either low or high, then we say you are diabetic. Now, so if I go straight, diabetes simply means it is a condition, it is a metabolic condition that comes as a result of your body's inability to regulate the glucose in blood. I hope my viewers, you are understanding this, because I want you to understand this, because when someone says, I have sugar, yes, everyone must have sugar, but you must have the right amount in blood.
Okay, so let me recap just to make sure that I'm still following. So we must have the right level of glucose that we get from consuming food that has carbs.
Yes.
So while the blood is doing its thing, the body is doing its thing, there's a certain level of sugar that must be retained in the blood, and then there's a certain level of sugar that must be stored.
Enter your body cells for energy production. If excess, stored.
Exactly. Any excess, stored. So when it's stored, then what happens? It's brought out when we need it, when we don't have enough.
Now, what happens is that the excess sugar that has been absorbed into your body, one, it is stored as glycogen in your liver. If it is more than the liver can store, that glucose is converted into fats. Now I'll give you one live example. You know, majority of individuals that consume beer, you find that they have
pot bellies.
Now, they end up asking themselves, leave alone those who even add on pork, but those who take it alone and still, so they ask themselves, where is this fat coming from?
Beer is a little sour.
Because beer, one of the key ingredients is either sorghum or barley or corn. Those are high carbohydrate foods. And because these people consume a lot of that, then they end up generating a lot of glucose in the body, eventually converted into fats. And fats, naturally, they are first stored around the belly.
That's for everyone. Everyone has a natural disposition of having fats distributed about their tummy in excess. That's like for the average people, like for everyone, or particular people?
Naturally, the fats are stored fast around. Yes. So I hope now we understand what diabetes is. Your body's inability to regulate the amount of glucose in your blood. And that is attributed to the functioning of the hormone insulin. Now, that takes us to another level. So for you to eat your food, how does this insulin work or respond? And that's where eventually we shall move to diabetes. So from day one, we should know that everyone needs glucose or sugar to give you the energy for different body systems and organs. But the moment the body is not able to regulate what is in blood, if it goes high, then you are diabetic, or what we call hyperglycemia. If it goes low, then still you are diabetic, and that is what we call hypoglycemia. It means those who have, you must have, to be healthy, you must have the normal sugar levels.
Okay, doctor, allow me to interject. I don't know whether I should bring this in when we're talking about how does one treat diabetes, or as an alternative, does the glucose that is produced in our systems after carbs are broken down equivalent to the glucose that you find in the shops? The glucose, the ones people take while they're, under a lot of activity, or we can even take it like here when you just maybe haven't eaten and you just need energy, you'll be like, let me get glucose.
Okay, thank you, Tracy. One thing we need to understand is that, for example, you see athletes taking glucose after exhaustion. When you are doing exercise, you are spending energy. Have you ever gone for a marathon? Can you go for 5 kilometers?
Yes, I have. Ever since the lockdown actually started, I run like 6 kilometers every Saturday and Sunday. Jog, not run.
That is very, very good. So when you go for an exercise, for example, a marathon, you end up spending almost all the energy that you have in your body. And even the body can go to the reserves, the stored glycogen in the liver. Now, after that, you need an instant source of energy.
Yes.
And the best source of energy in that context is the glucose.
The one we get from the shops.
So the one we get from the shops, it is a processed form of a carbohydrate giving you the final product of carbohydrates. That's why when you take it immediately, you feel rejuvenated because it is directly absorbed. So going back to our diabetes, someone will ask, now, there's this insulin regulating the glucose. How is it instructed? How safe am I? Now, that brings us to the different types of diabetes. Because what happens, for example, if you have any damage to your pancreas, now we are shifting to the different types of diabetes. Because you'll notice if you've interacted with people who are diabetic, you find some of them using injections, you find some of them using tablets. And for those who are not aware, they get confused. Now, what happens is, if there is any damage to your pancreas, I said the pancreas helps in production of the hormone insulin that helps in regulating this amount of sugar in blood. Now, if there is any damage to your pancreas, then it interferes with insulin production. Now, the moment you produce less insulin, it means your body is not able to regulate the sugar levels in your blood. The regulator is not there. So there is either an increment of the sugar or a decrease in the amount of the sugar. Then we say you are diabetic. And specifically, when your body cannot produce enough insulin, then that's what we refer to as type 1 diabetes, or traditionally referred to as insulin-dependent diabetes mellitus. And you find those individuals on injections.
So they'll need support to produce insulin. So insulin is injected straight into their bodies to help them with the whole carb conversion to glucose and stuff.
Exactly. When you see someone taking a shot of insulin, it means the pancreas is not able to produce, so we directly give you the insulin. And some of you will ask yourselves, why injections? Why can't they give us something to swallow? Insulin being a hormone, if you pass it through the mouth, it will get digested as a protein, so it won't do its work. So that's why it is administered intravenously, direct to the blood vessel or the blood.
Yes. Interesting. So that is type 1.
That is type 1 diabetes.
And type 2?
Then we have what we call type 2 diabetes. And the easiest way to know it, you find that individual on tablets. The moment you see an individual using tablets in management of sugar or diabetes, then that person automatically has type 2 diabetes.
Why tablets?
So the question is, what is type 2, or how different is it from type 1?
Yes.
Now, type 2 diabetes, as I explained earlier, the glucose gets into the blood. Then it must be moved from the blood to the cells. However, this movement is facilitated by the hormone insulin. Now, individuals who experience type 2 diabetes, in most cases, actually all cases, they've accumulated a lot of fats in the blood vessels. They've accumulated a lot of fats in the blood vessels, or what we call the cholesterol. And that's why it is prevalent in individuals that are obese or overweight. Those two words don't mean the same, by the overweight and obese, but maybe that's a topic for another day. But if you are overweight or obese, it means you are at a high risk of getting type 2 diabetes. Now what happens? If the fats are too much in the blood vessels, then they inhibit the movement of sugar from blood into the cells. So there's a barrier there. So it means the sugar or the glucose remains in the blood. And definitely that will result into high blood sugar, or what we call hyperglycemia. And that individual will be diabetic.
Okay, so what then do the tablets do? Do they reduce the cholesterol? Do they help with faster absorption?
Yes, I want to get there. But maybe before we go to management, I want to share with you some of the signs and symptoms of diabetes. Something that should tickle your mind and you're like, I need to go and check my sugar. Though the advice should be after at least 4 to 6 months, you should check for your sugar levels. And even before I go that far, don't wake up in the morning, you've taken your heavy breakfast, and then you run to the clinic to check for your sugar. It will give you a wrong result. Reason being, the sugar will have just been generated in your blood, and you actually find yourself with high sugar.
Maybe, doctor, so before you tell us, how do I know that I have diabetes? Who gets affected by diabetes? Is it young people? Like, from what age is someone susceptible to getting diabetes?
Now,
teenagers, middle-aged women?
Unfortunately, now diabetes has no age. However, you find that type 1 diabetes is more common in infants or young children, because sometimes they are born when the pancreas is already damaged, so it can't produce enough insulin. But also, on the other hand, it is very unfortunate that even the infants and the young children are also getting type 2 diabetes, because we are feeding them on a lot of junk. I'm very sure these days when you move around town, you see some kids and like, this one is, he's too obese. And that makes them susceptible even to type 2 diabetes that originally was more common in adults and old age, because that's when we start accumulating a lot of fats. But then there's another type of diabetes that I don't want us to throw aside. This one, men, we are safe. It is only in ladies. It is called gestational diabetes. You experience the signs of diabetes when you are pregnant, and I will explain that. But fortunately, if after delivery, if you handle your feeding well, it automatically goes away. If you don't, then it translates into type 2 diabetes. And the reason is simple. When ladies are pregnant, they accumulate a lot of fats in preparation for the breastfeeding period. And these fats then can make them have those signs and symptoms of type 2 diabetes.
So how then do we now know? What are the symptoms? Someone is getting sick, how do they
symptoms
tell?
Of diabetes. One, please, these are not confirmatory tests. They are just signs and symptoms that should tickle.
So one would have to first go get checked to confirm if they have it.
Yes, but there are things that can tickle your mind and
the red signs of, hey, you might not be doing well.
Yes. One, frequent urinations. You find every time you want to go and urinate. Number two, frequent thirst. Every time you feel thirsty, because of the high sugar levels in your body, they demand the body to take in more water. Then number three, you feel fatigued and exhausted almost every time. Number four, some people lose weight, a lot of weight. Actually, some when they go to the clinic, they first test for the other disease than the diabetes because you have lost a lot of weight. Number five, your appetite for food also increases, unfortunately. So you find every time you want to
eat.
So those are some of the warning signs that if you experience them, please go and check if you've not checked yet. Yes.
All right, thank you, Dr. Mukama. So, dear viewers, these are some of the symptoms that can actually just throw some red flags for you to just go out there and try and figure out what is up with me, what is really up with me. Now, the beauty is Dynapharm has something for you, and Dr. Mukama is going to talk about that. Dr. Mukama, how does Dynapharm come in? What role does it play in helping us fight diabetes?
Okay, before I come into Dynapharm management, I need to add some few things. Please, for everyone that wants to check for sugar or diabetes or glucose levels, kindly do what we call a fasting glucose test. What does it mean? In the morning, don't eat anything, but you can have a glass of water, and then you go for your test. It won't give you misleading results. It will give you exactly what is in your blood. Then, also on the other hand, we need to be mindful that diabetes is associated with very many health risks. The high sugar levels damage your kidneys, so you have to be very careful. They damage your nervous system, and that's why you find, and this is to men, the moment you are diabetic, I can assure you your sexual health or sexual life will be completely different, because the high sugar levels damage the nervous system. So there is limited communication between your brain and your organ downstairs. Number three, they also damage your sight. Most diabetic individuals, they have issues with their sight, and it's because of the high sugar levels. Ladies, I'm not sparing you. The moment you are diabetic, you become susceptible to frequent infections, because the bacteria or even the yeast that attacks you down there thrives best in sugary conditions. So even when you have those frequent infections, please kindly check for your sugar levels.
Okay, that's some good knowledge for us.
So going to management, as I told you, in conventional treatment, the type 1 diabetes, usually they are the insulin injections. For type 2, the target, the regimen usually are the hypoglycemic tablets, the metformin, etc. Now, Dynapharm has very good news for you. Thank you for clapping for Dynapharm.
Drum roll.
In Dynapharm, we defy the notion of saying chronic diseases cannot be reversed. You find people who are diabetic, they've been on medication for 5, 10, 15 years. And when you engage them and ask them, when are you stopping these tablets or injections? Until you rest.
Literally no cure. You have it for life.
However, and I want us to take this one seriously, in Dynapharm, we can help you live a better life. We can reverse most of these conditions. Let me start with type 2 diabetes. As we said, it is accumulation of fats in your blood vessels. We have products that have the ability to cleanse out, to take out the fats. Yes, it's a gradual process, but eventually the fats are removed, and then you have a good movement of glucose from your blood into the cells. You are able to regulate your blood sugars. One of them is here. Garlic capsules. I'm very sure you've heard around different circles, people are diabetic, take a lot of garlic, but you know it is a hard substance to take. However, in Dynapharm, this is pure garlic 100%, and it is in a capsule form. So you're not going to have issues consuming this product. Number 2, in our earlier episodes, we talked about cleansing. It is mandatory, it is our protocol in Dynapharm that before we give you any product for any disease or condition, you first do your thorough cleansing and detoxification. We have garlic capsules here that are very good in cleaning up our blood vessels for good movement of glucose from the blood into the blood vessels. And most individuals are worried about the smell of garlic. Fortunately, in Dynapharm, our protocol is very simple. Before we give you any other product for any disease or condition, in this aspect, the diabetes, we first do some thorough cleansing and detoxification using our wonderful product here. The beautiful thing is that the moment you use the chlorophyll with the garlic will never smell. So the bad odor of garlic is taken away, but at the same time you are getting the benefits of garlic.
So doctor, you've spoken about chlorophyll quite a number of times. We had a guest here, Peace, some time ago, and her father had a kidney issue, and when she was starting treatment for the father, they started with this. It seems it's very, very, very important drug with all the sets that you give someone to get better. If you could probably enlighten us more about why it's like so important with every treatment, because you've said for anyone who is going to start with that, you always encourage them to first cleanse,
exactly,
to detox.
Yes. It is important, and this is where some treatments, they get it wrong. It's like if you want to put a new paint in your house, it is very paramount that you remove the old paint. Now, we don't want to give you a product and then the wastes that are in your body interfere with the efficacy of the product. So that's why it is paramount in Dynapharm that you first cleanse and detoxify so that the body is absolutely clean. At the end of the day, when we give you those subsequent products, they will exactly get into the body and do what they are supposed to do without any interference. So it is very important to cleanse and detoxify first.
That is a very good explanation. We can move on to...
Well, the other product that is very important in management of diabetes are the ginseng capsules. And the beautiful thing is that they support production of the insulin and also absorption of glucose from the blood into the cells. And those even who already have nerve damage, or what we call neuropathy, it is important. This is one product that helps in repairing your nervous system. So Tracy, you can have a look at that product.
So this complements all of these treatments?
Yes, we are managing our diabetes type 2. We don't stop there. We add another wonderful product, which is Uganda capsules. As I mentioned before, this is made out of a very wonderful mushroom. And this mushroom has, we call them the active ingredients. And for this aspect of diabetes, we have the triterpenoids inside here. They help in removing the bad fats in your blood vessels for easy movement of glucose from the blood to the cells.
When you say active ingredient, what exactly do you mean?
What do I mean? It's like when you are consuming or when you are using any drug, not everything that you see in a tablet or in a capsule is actually important to your body. But there's that one component.
The reason why you're taking.
Yes, the reason you are taking the medicine. So for this product, the Uganda capsules, the active ingredient in management of diabetes are the triterpenoids. Very important. So at the end of the day, we are able to manage an individual that has type 2 diabetes. And I can assure you, it's always a question of time. You go back to your doctor and checks your blood sugar and it is normal, definitely they will take you off whatever medication that you are having. It's not us to take you off the medication. It is the doctor that is managing your sugar.
Interesting. There's a third type that you spoke about that you didn't want to leave out. Does that also have a management plan with Dynapharm?
Yes, I talked about type 1 diabetes. And I said it's caused by damage to the pancreas. And science shows that the biggest cause of the damage to the pancreas is an autoimmune disorder. The immune cells, instead of protecting you, they damage some of the key cells that produce the insulin in the pancreas. They are actually called the beta cells.
Yes.
And it can be initiated by viral attack, etc. So how do we help such individuals? One, it means we need to boost their immune system so that it stops being reactive. And we have wonderful products. Still, we have to cleanse and detoxify. Our chlorophyll must be part of that regimen. The ginseng capsules are very important. But additionally, we have very powerful immune boosters. That is, unfortunately, they are not on this table. It is called ProLink and then the noni juice. So for type 1 diabetes, we are trying to manage your immune system to stop damaging the beta cells in the pancreas. And those are the products that we give you. Maybe I want to mention one thing, that when you have diabetes and you are under treatment and we give you Dynapharm products, we don't stop you from the other treatment you're having. You use them simultaneously. But the condition usually is don't consume them at the same moment. Because these are herbal products, some of the active ingredients might interact with some of the active ingredients in the pharmaceutical drugs. So usually I would recommend you give them a gap of at least 3 hours. Use them both, but give them a gap of at least...
Once you take the other shot or the tablet, you wait for 3 hours.
At least 3 hours, and then you can have these products. So that's what we call complementary medication.
All right. Thank you, Dr. Mukama. I think this has been a very eye-opening, very full of facts, because it's a particular section of a disease that has troubled a lot of people, especially because they know, they are told that once you get diabetes, it is bye-bye for you. Just embrace the needle, embrace the tablets, and then you're done for. Dynapharm is standing with you, giving you all these natural organic options on how to manage the diabetes and then eventually live better. Does it cure? Did you say it cures?
And before we go to that, I wanted to mention one or two things being a nutritionist, because there are so many, I usually call them corridor talks out there in the public. If you are diabetic, don't do this, don't do this. I want to put some things straight. Number one, some people ask, does sugar cause diabetes? Consumption of sugar, the sugar we put in the tea. It is a high risk. It puts you at a high risk of developing diabetes. Then, can a diabetic person consume fruits? The answer is yes. But you don't consume fruits that are fully ripe. You consume fruits that are just starting to ripen. Does a diabetic patient consume juices? The answer is no. Because at the end of the day, we are fighting to make sure that the sugar levels in the body do not shoot high very fast. So juices are out, the sodas are out. Please, I'm talking about all the sodas. There is a lot of confusion there out in the market that a diabetic patient can consume this and this. Please forget about the sodas. Then in terms of the other foods, please avoid the highly refined foods. The white bread, please put it aside. Portion number one, please put it aside. If it is beer, please forget. Leave the beer for the other people.
All right. Thank you so much, Doctor. We'd go on and on and on about this topic. Please do leave a comment in case you have more questions. Because of time, we cannot go any further. The number is streaming down below, so you can reach out to us. One, you can drop a comment and our team of experts shall be ready to answer your questions about still diabetes. We have plenty of videos on our YouTube channel. If you still have questions, just drop them there. We will answer you. I'd like to thank you so much for tuning in and for continuously always watching the videos. Please do not forget to subscribe, like, and most importantly, recommend. There's someone out there who needs this information. There's someone out there who thinks that because they have diabetes, they cannot live a happier life or a healthier lifestyle. Dynapharm is here to just put your worries aside. Come, let's take you through what to do and so that you live a healthy lifestyle. From us, Dynapharm, thank you so much, Dr. Mukama, for always availing your time to share with us. From us at Dynapharm, thank you so much for always tuning in. And remember, health is wealth. I'm your host, Tracy, looking forward to sharing with you next time.